If your dog has just been given steroids for whatever reason, then they might be drinking a lot of water. But is this a concern? Is there any problem with this? Well, today, that's what I'm going to be talking about. So my first question today is from Earl, who writes that his vet prescribed his golden retriever with prednisolone, and he knows that prednisone can make them thirsty, but this dog is drinking an awful lot, and he's going to be on this drug for quite a while. So can that much water harm him in any way is really the question today. So I'm going to start off with by saying the two biggest side effects when we're giving steroids, especially when steroids are started or if they're given at high doses, are an increased appetite, along then also with drinking and urinating a lot, which is what this dog's likely doing. So the increase in thirst is really a result of the peeing. So the dog is actually producing larger volumes of dilute urine because they're on steroids, and so needs to maintain their hydration and maintain their hydration levels just by drinking more. It's important from this point of view never to limit their water intake, because it's not the drinking that's causing the problem, it's the urination. So if you are taking steroids or you're giving your dog steroids for any reason at all, it's really important that they should always have access to plenty of fresh drinking water. If you limit that water, it's not going to change the amount of urine that they're producing, so it's not going to stop any accidents that they might be having or they might have. But what it could do is it could lead to your dog becoming really dehydrated, and it's important that that obviously doesn't happen. Now, if we think of what excessive drinking is, well, a normal water intake is typically around 50 ml per kilo per day, with an excessive drinking level kind of known as, which is what we call polydipsia, being defined as drinking more than actually 100 ml per kilo per day, so over twice what this normal level would be. So for this 80-pound dog, that would equate to just over 1 gallon or a little over 3.5 litres to be considered abnormal. Now, Earl says that his dog is drinking 1.5 gallons, so that clearly says that's abnormal, but we know why that's happening, because this dog is on steroids. Now, for a dog that wasn't on steroids, then this level of drinking would actually, or should actually, trigger testing to try and diagnose what the problem is, because clearly it's an excessive amount. Now, drinking and urinating, they really are common symptoms for a whole load of different conditions, especially conditions of older age, and that can include diabetes, liver disease, kidney disease, some hormone abnormalities, and many other conditions as well, including some cancers. And so we shouldn't ignore the fact that our dog is drinking more than they used to. Some dogs, they don't need to drink this high levels to be classed as abnormal. So if your dog isn't a particular big drinker, and especially if they are getting a wet food where they will be getting a lot of water from their food, you shouldn't wait until they're drinking ridiculously large volumes before you start to think that there's something wrong. So any kind of increasing levels of thirst or peeing a lot more should trigger an investigation, a trip to your vet. Ideally, if you take a urine sample, that would be great. The most useful urine sample is the first one that they produce after being asleep all night, because that's the one that should be concentrated, and that will be concentrated if there's not really a problem. If it's still dilute, then that will trigger blood testing and other investigations. Now, in this case, drinking that amount is not going to cause any problems. Like I say, what it's doing is maintaining hydration, and problems will come about by restricting this water intake. Now, if you're having problems with your dog having accidents, so they're peeing overnight, they're having accidents in the house, it's tempting to say, well, the steroids are causing problems, I'm just going to stop them. But it's important to say that steroids should never be stopped suddenly. The dose should always be tapered down slowly. And the reason for that is that stopping steroids suddenly can cause something known as an Addisonian crisis. And that can actually be fatal, because what happens is your body stops producing stress hormone because you're giving extra steroids through the medication, and it takes a little while for that to kick back in. And what happens if you stop suddenly is that there's no stress hormone, and that's really actually important for the body to function in a whole load of different ways, and you get something called an Addisonian crisis. So it's always important to follow your vet's instructions with whatever medication you're giving, and certainly with steroids, it's important that we wean them off slowly. If you are getting severe side effects, that either you or your dog are struggling to cope with, then really always talk to your vet before you change treatment to see if there's any other things that you can be doing to help manage those side effects a little bit more effectively, and to make sure that we're not getting into dangerous situations by just stopping the medication.
You've been watching the Dr. Alex Answers video podcast. Remember to subscribe and head over to dralexanswers.com for any links, downloads, and get your question answered.